When we think of trauma, most people imagine events like accidents, abuse, or disasters, but what if some of the most hidden and long-lasting forms of trauma actually come from hospitals, clinics, and medical procedures? Medical trauma, also known as medical PTSD, is a silent struggle that countless people carry without even realizing it. Maybe you've had a surgery that went wrong, a doctor who dismissed your pain, a diagnosis that left you terrified, or a hospital experience where you felt powerless, trapped, and unheard. The body might have healed from the procedure, but the mind and nervous system continue to carry the scars. You might find yourself feeling anxious whenever you walk into a clinic, your heart racing at the smell of disinfectant, or avoiding checkups because just sitting in a waiting room sends waves of panic through your body. This is not weakness, it is your nervous system remembering danger and bracing for it, even when you are safe now. The question is, how do we heal from this invisible wound? Healing medical trauma begins with naming it. Simply recognizing that your fear, panic, or avoidance are not random but connected to real past experiences can be deeply validating. Your body is not broken, it is trying to protect you. The next step is learning to work with your nervous system instead of against it. When you notice flashbacks or panic, try grounding techniques, feeling your feet on the floor, noticing 5 things around you, or holding a comforting object. These simple actions remind your brain that you are here in the present, not back in that hospital bed. Another important piece is rebuilding a sense of choice. Medical trauma often comes from feeling powerless, so slowly reclaiming agency is healing. This could mean asking questions at appointments, bringing a supportive friend with you, or even practicing what you want to say to a doctor beforehand. Every small act of choice tells your brain, I am not trapped anymore. Processing medical PTSD may also involve gently revisiting the story of what happened with a therapist, journal, or support group. When you put words to the memories instead of avoiding them, the nervous system can start to release its grip. And let's not underestimate the power of the body in healing. Practices like breathwork, yoga, or progressive muscle relaxation can help discharge the stuck energy of fear that gets locked in after traumatic procedures. Even short daily practices of calming your body can retrain your brain to associate safety with medical settings over time. Healing does not mean erasing the past, it means teaching your nervous system that you survived it, and you are safe now. Perhaps the most powerful shift comes when you realize you are not alone. So many people suffer silently from medical PTSD, believing something is wrong with them for dreading checkups or panicking in waiting rooms. But this is a normal response to abnormal experiences. By talking about it, seeking support, and practicing regulation skills, you can move from fear and avoidance to empowerment and resilience. Imagine walking into your next medical appointment with your heart calm, your breath steady, and the knowledge that you have tools to support yourself. That's not just healing, that's transformation. The scars of medical trauma don't have to define your relationship with your health. With patience, self-compassion, and the right strategies, you can teach your body and mind that the danger is over and a safer future is possible.